The reason of multiple sclerosis is still unknown. In the white matter of brain and medulla oblongata, nerves in the so-called plaques are free of myelin sheath. This is combined with neurological failures, from visual disorders to complete lameness, followed by death. Most frequently, the idea is followed that it is an autoimmune disease, an attack of the immune system on myelin sheaths of nerves. We will focus, therefore, on the immune system. All plants and animals have developed mechanisms to protect against bacteria, virus or fungi. In animals, this is the immune system. There are several defense mechanisms. The oldest and simplest are macrophage that pounce on everything seeming to be non-self and digest it. In most cases, this is sufficient. This defense is not at all specific. Very specific, however, is if a macrophage presents the intruder to a THO cell. From this point, there are three possibilities. THO cell becomes a TH1 cell using a killer cell for destruction. This immune reaction is called cellular or TH1 modulated. It is very specific, like the second reaction, humoral response, against a specific intruder, often even against a singular molecule on its surface. In the second case, THO becomes TH2 using a B cell. This B cell is transformed to a plasma cell producing specific antibodies. The intruder is glued by antibodies to an antigen-antibody complex. This complex can either be destroyed by a macrophage or it acts on the mast cells that releases histamine and starts an inflammation, e.g. in allergic rhinitis. For cellular as well as humoral immune response, there exists a memory. The body remembers for some weeks, sometimes a lifelong, to this reaction. After new contact, it reacts quicker and more effective. Vaccination is based on this memory. After an attack and an immune reaction, it is necessary to bring it down. Otherwise, there is a change of an attack to other tissues of the body, an autoimmune reaction. Demobilization is performed by suppressor cells. Natural killer cells dissolve cells, cytolysis, as well as antigen-antibody complexes. Cellular immune response is against virus, intracellular bacteria and parasites, while humoral immune response is against bacteria, gut parasites and extracellular parasites. Multiple sclerosis is thought to be a cellular autoimmune reaction, while antibodies can be even protective. How it is decided whether a cellular or a humoral immune response occurs, whether a THO cell becomes a TH1 or a TH2 cell. This is decided by the pattern of cytokines. The decision for one way inhibits the other and vice versa. The decision is made by dendritic cells for making a TH1 cell from a THO cell. Interleukin 12 and interferon gamma are necessary, while making a TH2 cell requires interleukins 10 and 4. In the present, our idea of autoimmune attack in multiple sclerosis is nerve fibers are also electrically conductive connections between nerves. It is necessary to isolate them, therefore. This is the function of myelin sheath. A cellular attack destroys myelin sheath, partly or completely, and a short circuit results. This short circuit causes neurological faults. After a while, nerve fibers are destroyed completely. How can multiple sclerosis be treated with natural substances? Dendritic cells can be controlled by epigallocatechin gallate, EGCG, from green tea, as well as with fumaric acid and Th1. Modulated cellular immune reaction is downregulated. Epigallocatechin gallate also shows an action on amyloid fibers. A wrong folding of these fibers causes important neurological disorders like morbus Parkinson and Alzheimer's disease. EGCG affixes to not yet folded polypeptides. Instead of dangerous fibers, spheric oligomers result. Big, ripe alpha-nucleic acid and beta-amyloid fibers. Fumaric acid not only acts on dendritic cells, but also on progenitor cells or precursor nerve cells, and causes the formation of nerve growth factor NRF2. Since nerve cells grow very slowly, it takes a long time, 1 year or more, for a positive result. Glycine, an amino acid, binds to glycinergic receptors in brain, stem, and spinal cord, and stabilizes the balance on excitatory and inhibitory neurotransmitters. Glycine also stabilizes respiratory rhythm in the respiratory center of the brain and neuronal control of muscular tonus by brainstem and spinal cord. Both mechanisms, together with a synchronization of nerve rhythm, antispasmodic acid, and sedation, make glycine a substance of stress preparation and stress treatment. 15 patients had taken EFG for more than 2 months. 12 of them improved, 3 out of them drastically. In 2 patients, it stayed equal, and 1 had a little worsening. Improvement rate is 80%. No effect can be expected, however, before 2 months. All drastic improvements had taken EFG for at least 6 to 12 months. In 4 cases of drastic improvement, lesions had been reduced. 4th cases not yet inspected. No negative side effects could be found. To be registered as a drug, 8 to 10 million euros are necessary. Look at crowdfunding of this video. As far as the figures go, each of about 1 million multiple sclerosis patients would have to spend 10 euros only to make a drug available in a few years. That really helps, and that is much cheaper. 80 euros per month or 960 euros per year in comparison to 30,000 euros per year of current medication. You can read this information, including case studies and scientific background, in www.ega-recipes.com. It is evident you can buy green tea at the next supermarket. To get an effect in multiple sclerosis, however, you would have to drink enormous amounts. Nobody is able to do this. Imitation products. A therapy is only possible if green tea extract, fumaric acid, and glycine are prepared as quantum dots. The technical term quantum dot cannot be protected and everybody can use it. The effect, restore of cellular immunity, is only fulfilled if producers or distributors use the term produced according to Quantenpunkttechnologie nach Gradl.